All prenatal diagnostics are voluntary. During your pregnancy, it is you who decides whether or not you wish to receive information about prenatal testing. It is you who chooses whether or not you want to have prenatal testing done. If you wish to have prenatal testing done, your healthcare provider will inform you about the options that are available to you. During your pregnancy, you will likely be offered tests that can provide information about whether certain congenital disorders or genetic conditions are present in your baby. Tests you may be offered include blood tests, ultrasound, or a procedure such as amniocentesis. It is important to keep in mind that most babies are born without any type of condition or congenital disorder. However, with all pregnancies, there is a 3 out of 100 probability for this to occur. This video will provide a brief overview of some of the conditions that may be tested for during pregnancy. This information can help you have a more in-depth discussion with your doctor about the testing options and the conditions that are tested for. When it comes to tests during pregnancy, there are typically 2 types of conditions that are commonly discussed: congenital disorders and chromosomal conditions. Congenital disorders can occur in anyone and do not always run in the family. You may have heard of some structural malformations such as heart defects or cleft lip and palate. The severity of congenital disorders is variable, and they can often be treated. Other examples of congenital disorders are neural tube defects. Neural tube defects involve an opening in the spine or the skull. One example of a neural tube defect is spina bifida. Another example is anencephaly, which is more severe, life-limiting neural tube defect. Other types of conditions that may be tested for during pregnancy are chromosomal conditions. Chromosomes are structures that hold our genetic information, the information that tells our bodies how to grow and function. Chromosomal conditions occur when the baby has extra or missing genetic information. These conditions usually do not run in families. Although the likelihood of having a baby with a chromosomal condition increases with the age of the mother, babies with chromosomal conditions are born to women of all ages. One of the most common chromosomal conditions is Down syndrome, also known as trisomy 21. Trisomy 21 means that there are 3 copies of the 21st chromosome instead of the typical 2 copies. Individuals with Down syndrome have some degree of intellectual disability that can range from mild to severe. This condition is also associated with medical concerns that are often treatable. Other chromosomal conditions that may be tested for include trisomy 18, Edwards syndrome, and trisomy 13, Patau syndrome. Both of these conditions are associated with life-limiting medical complications. Some prenatal tests can look for milder chromosomal conditions related to differences in the number of X and Y chromosomes. These conditions are called sex chromosome variations. Examples of these variations are Turner syndrome and Klinefelter syndrome. Children with sex chromosome variations do not usually have intellectual disability. However, they may have a learning disability. Some of these conditions are associated with a higher likelihood of having health concerns that are often treatable. Because these conditions can be so mild, some individuals may go through life without knowing they have a sex chromosome variation. In summary, prenatal testing can look for a wide range of conditions, from mild to severe. But it is also important to know that no prenatal test can rule out all genetic conditions or congenital disorders. If you have a family history of a specific genetic condition or congenital disorder, or questions about anything presented in this video, we recommend you talk with your doctor or genetic counselor. You can find more detailed information about these conditions on Snif's website, the Swedish Healthcare System's website, 1177, and the National Board of Social Affairs and Health, Socialstyrelsens website. Please watch the other videos in our series to learn more about specific prenatal testing options and how to decide if prenatal testing is right for you.